To begin the leg, first let's talk about draping. You want to take the corner where the top foot is, bringing it, making sure not to expose her, right? So bringing it to all the way down to tuck it underneath the hamstring. This side, we're going to bring and tuck it in under the medial hamstring, anterior medial hamstring. As we expose the thigh, we are going to add this kind of U shape and slowly curl and tuck the drape so that it's not exposing any parts that we do not want, but it's giving us this nice working space. So I have it tucked underneath both parts of the thigh and rolling that rest of the sheet up to make space. Now I'm going to, if her foot is exposed a little bit, I always like to cover it up too. So make sure that it doesn't get too cold, her feet get too cold. So applying lotion. Starting at the foot, every stroke is purposeful, right? So even applying lotion is a purposeful stroke. Adding that, elongating, I'm going to get just slightly more lotion. Bringing this lotion all the way up to the thigh. Getting the hamstring and the quad. And the drape acts as a boundary, but you can go just beyond that boundary into the glutes. And that is okay as long as your client is comfortable with it. If she said she did not want work on her glutes, gliding work on her glutes, then you respect her boundary and you do not go beyond the barrier of the boundary. But having this drape exposed in this manner helps her to feel comfortable. But if you go just slightly, a few inches under that drape, that is okay. That is safe and it helps, your client will feel safe. So I like to start at the proximal area first, working the hip to drain this part of the hip first, working down the leg, bringing that leg and then the bottom of the leg and then the foot. So starting up the top. So we applied our lotion, coming all the way up to the femur. So working along the femur. Remember the gluteal cleft, we are not pulling away, we are pushing towards. So starting at the base of the femur, along the hip rotators, using our fingers. So finger technique, sinking in at the femur and then stretching that tissue towards the gluteal cleft. And working all the way around the head of the femur. And stripping up. If your client likes a lot of pressure, you can also use your palms to give more pressure in this area. So after we stripped away from the femur, we're going to use our palm, this open side of the palm. This is our stabilizing hand, and we're going to stretch around that femur, stripping that tissue cross fiber. And I'm hooking into these hip flexors to that TFL right along the side with this portion of my hand. So hooking in, and you can even stop there for a minute and give it a little rock, compression, sinking in. That tissue in that anterior section of the hip flexors is always needed because of that anterior flexion that we get. So stretching and stripping that tissue along and around the femur. Working those glutes a little bit more. And then with our palms, we start to work down and along the leg. Stretching up. So our emphasis is on the stroke going up towards the head. I use my opposite hand as just dragging back down. So it's a motion where you're pushing up, and as you're bringing your hand back down, it's just a gentle drag. The main emphasis is on our pressure pushing up. So stretching on both sides of this IT band. The IT band can be very tender in certain spots. So being mindful of that pressure. You don't want to go directly on that lateral portion right here really deeply because it can be very tender. So going on each side of it, effleurage, opposite effleurage strokes. Bringing our palms, the emphasis is in my palms. I'm really not using my fingers. Fingers are just gliding along with the hand. But using the palms. The palm is the technique to really get that depth that is needed on the legs. So emphasizing first on palms on the hamstrings. And I'm using this as a guide, as a stabilizing hand, because if I don't have that, then it just feels awkward and I can't really push in together to get more pressure as well. So getting more pressure by stabilizing hand, opposite effleurage hand strokes. And then I'm going to transition with my left hand to stretch the quads. This vastus lateralis especially, getting up medially. So I love side lying because it protects that inner portion of the leg that we want to avoid, that we talked about in our contraindications. And this is a safe and effective way to work on our clients in the side lying position. It protects that whole inner portion of the leg, so we don't even have to worry about working on it or potentially releasing a blood clot, which is rare, but it is just something that we have to be cautious of. So bringing our hands back and forth, back and forth. The palms are creating this petrissage motion, effleurage and petrissage motion. So using our palm again, we're going to emphasize going up through the lateral quad and these hip flexors again, just addressing those because they are often very tight. Mamas, as they prepare for birth, sometimes are doing lots of squats and things like that, which also create a lot of tension in these muscles. You can also just do general petrissage. And then finish with some effleurage. Legs are simple. Legs don't have to be complex, and we don't need to spend a lot of time on the legs. They can feel good, absolutely, to work a little bit, but you don't have to spend a long period of time working on the legs. So that is the thigh. As I work down, when I'm done with that area, I don't leave it exposed. I bring that drape down as I work. So then I'm going to come around the knee using thumb over thumb. I'm going to work this knee just along the outer side of the joint. And then come in to the lower leg with petrissage. This lateral compartment gets so tight. So again, having the side lying work I love because it just exposes what really is needing to happen here. That external rotation that we talked about, this lateral line is typically what's tight and creating that also to stay externally rotated. So helping to get this tissue to calm down, to release, relax. And calf massage is also so good because we get calf cramps during pregnancy very regularly, some more than others, but it is definitely a part of pregnancy. Thank you, hormones. So stretching and massaging the legs can actually be a great remedy to those leg cramps, in addition to magnesium, which we spoke about before. Magnesium and stretching. So petrissage. And effleurage strokes. So for the purpose of the camera right now, I'm using my fingers to do these effleurage strokes. However, I'm often using a stabilizing hand again to provide that stability so that I can apply pressure, and then using my palm to stretch that tissue from the heel up to the knee, stretching and elongating that tissue. As you get to the anterior part of the leg, switch hands, and then this one becomes your stabilizing hand. So I am grabbing on and I'm holding this. If I did not have that, it would feel really awkward and weird for her. So by stabilizing and holding her heel, stretching that tissue up. That anterior tibialis is one that that can definitely use a little bit extra work sometimes too. It's a very awkward, hard muscle to stretch, and so getting some massage on it can feel really good. So using the emphasis of this part of my palm to stretch that anterior tibialis. Lower leg, simple. Petrissage, effleurage, very simple. So the ankle, using thumb over thumb to get that tissue and all the fluid that is kind of piling there because of gravity, accumulating there. We can thumb over thumb to just work all along the front of the ankle. And then moving into the top of the foot, using our thumbs to work through each metatarsal. And notice I'm creating a stretch with the toes while I'm working on those metatarsals. So I'm grabbing the toes and I'm flexing them while I'm stripping through each metatarsal. And come to the pads of the foot with thumbs. Coming into the arch. And then for the heel, I like to stabilize the heel with one hand while using the thumb in the other to give this counter pressure. The stability rather. One hand stabilizing the foot while the other hand is able to compress and push on that heel, which usually needs a little bit extra pressure than the rest of the foot. So here we're going to be working along the pad of the heel, bringing that tissue. I kind of grab it and then pulling it away from the bone to stretch. Some people have more of a pad than others, and it feels really good if a woman is having to stand long periods of time on her feet. So we will finish with a little bit of full hand petrissage on the foot. We cover her back up. And I like to do nerve strokes, feather strokes, to just close my session. In addition, in my practice, I like to add a few little extra special treats at the end of my session. I offer a hot towel that I place along their back, and I do a little bit of compression along their back, or I might wipe their feet off with a hot towel. I also have a balancing spray that is made from our local apothecary that I also like to spray over my clients at the ending, and it kind of signifies the closing of our session. So I'm going to spray Mara. And that concludes our session today.